warm welcome to our next startup, Minda Wilson, founder of Fluidity-Health.
Okay. Can you hear me? If you haven't been there yet, every person in this room is going to be involved in some way in taking care of their parents. It's something we're all going to have to face. I'm Minda Wilson, founder of Fluidity-Health. I developed our platform as a result of the difficulties I experienced taking care of my mom. The hardest part, from my point of view, was managing the various stakeholders and the misalignment of communication, bringing together the doctors, all my various family members, making sure my mom was properly cared for, all the while my dad, the HIPAA-compliant person, stood in the middle of all the medical communication that was going on. Our platform is a HIPAA-compliant, role-based care coordination tool. It operates on iOS, Android devices, and the web. It is FHIR-enabled, so it can integrate with any EMR, EHR, or device. It is role-based, so that patients can determine who has access to what information, and the app's features are all integrated. The patient information, including their medical history, assignment of rules, task management, secure messaging, calendaring, and all the health management functions, including data recording, monitoring of health-related data, medication management, and analytics. Our first customer was the VA. We provide services for veterans, and we bring together the Veterans Administration, caregivers, and family members in order to ensure there's an improvement in the quality of care received by our veterans. Not only have they received an improvement in the quality of care, but they've actually improved compliance with care plans and the level of satisfaction not only with the patients, but with the caregivers. The reduction of caregiver burnout has been really surprising. Our most recent client is a large, publicly traded dialysis patient, which has over 1 million patients. That company is using our product in order to make sure that the patients are coming and getting the best care possible so that they can keep them in the chairs and out of the hospital. We are very excited about the work we're doing with them. Our management team is robust. We have a lot of experience, technological as well as financial. I myself am a 3-time entrepreneur. This is my 3rd go-around. And we are looking for money to onboard new customers, to grow our business, and our immediate need is about $2 million. We expect to use that to build out our technology, pay for marketing expenses, and provide customized services for customers that are interested. That's it. Do you have any questions?
Yes.
So our competition, one of the things I wanted to make a point about competition was the VA did an evaluation of the market to determine whether or not we could be a sole source contractor with the VA, and they found no one that provided the complete level of service that we did. There are customers that provide parts of what we do, but nobody bundles it all together. And with issues like app fatigue and multiple platforms that they want to reduce, they looked at us as a good solution to that.
Hi, so I'm sorry, I didn't really understand what it is your product or platform does. Would you go over that for me one more time, please?
Okay, so what we do is, let's say I'm a patient at the VA, and I need to communicate with the doctors, the hospital, my family member, my friends. I have a caregiver that manages my care, and then I need to, and then I have to organize the information so that care is delivered properly. We do this by providing services and analytics. So the services we provide are messaging, HIPAA compliant messaging, so that everybody in the care circle can talk to each other.
There's a messaging service.
Yes. Coupled with a task management program. The task management program allows for group task management, and groups can be identified by the patient, by the doctor, by the family members. So the doctor can use the task management system to issue orders and see that they're carried out. The family members can use it for things like, mom needs slippers, who's going to get them? You know, and then integrated with the messaging system, they can ask questions like, does she want blue slippers, or red slippers, or pink slippers? What size does she want? You know, size 8, size 7. So all that can be communicated, and the communication is interactive as opposed to one bi-directional. So in addition to that, there's a calendaring piece which allows you to post all the appointments and then allows people to integrate with the task management system to see who's going to be taking someone to an appointment. So for the dialysis company, it's very important to make sure that people come to their appointments. So they want to know who's bringing that person. They want to send a reminder. They want to make sure that person is there. And if that patient isn't coming, then they want to make sure there's a substitute or there's an arrangement for a service to bring that person to their dialysis appointment. So, and then coupled with that, there are health management tools. We can record at home all the issues related to their health, like what their urine output is, all the things you do at home. We can keep track of that, and then we can provide analytics, and then there are tools to report that information back to the doctors, back to other family members, back to caregivers, so that all that information is exchanged on a single platform. And then
That was so much better than the original pitch.
Thank you. But it's longer too. It's more than my 3 minutes.
I don't know. It's very good.
Do you have any, so is the product like it? Like,
Yes.
Do you have any early metrics on like the engagement? Are people setting
We have some soft metrics, but we don't have hard metrics. One of the interesting experiences we've had with the VA is that they're not sharing their metrics with us. So we have stories, which are really wonderful, about how people's lives have benefited and how the caregivers' lives have improved. We show long-term engagement where people, once they get on the platform, are continuing to use it because we can see that through our own metrics and the metrics we share with the VA, but we don't have specific metrics at this point in time.
Is iOS the more popular platform out of
Actually,
or Android? Or?
well, so a lot of the caregivers were given Apple products. So a lot of the caregivers are using the Apple products, but for the people themselves, the family members, Android is also very popular as well.
Okay, we got a question.
Super quick one. Just really quick, it'll help.
Gotta be really quick.
Good pitch, number one. Two, I assume it's DaVita, it's the dialysis clinics. You don't have to confirm or deny that. And if it isn't, 1 million patients is a lot. Two, VA, very credible. The one thing you didn't reference is that you're harvesting data, you're harvesting analytics. If you anonymize that data in those analytics, you should be able to monetize that. So it seems to me that there's a huge upside for you that has a different multiple than the multiple platform that you're talking about. Have you considered either of those? And the other question is, why is the VA and the other company not invested? Is it strategic? And if they have, then forget the question.
The VA has not invested, and they don't invest. In fact, one of the things, you know,
The other
they're not
company,
in
the other
is-
company, right, the dialysis
So,
company.
we've been having, there's been some discussion.
Okay. On the data?
Huh?
On the data, on anonymizing and monetizing the
No,
data?
on what our relationship's gonna look like going forward.